Conversation. I'm dizzy and weak from having diarrhea several times. I also have a chronic stomach ache.
How long has this happened?
2 days.
It seems like you have a fever as well.
I think so.
Was there blood in your bowel movement?
Yes.
Okay, I'll take your temperature. You have a fever too. You should avoid alcoholic and cold drinks and spicy food. Try to avoid psychological stress. I suggest you take food high in protein and vitamins.
So, what's wrong with me? And is it serious?
I'm afraid this disease is quite serious, but
Conversation.
not fatal.
I suddenly have a terrible stomach ache and vomiting. The pain is worse when I cough or breathe deeply. Sometimes it hurts below my ribs on my right.
How long have you had the pain?
About 1 day. I hiccup and I have a fever too.
Please lie down here. I'll examine you.
Okay.
You seem to have peritonitis. Let's take an X-ray to make sure.
Okay.
You have to have an emergency operation.
Oh, right now? Conversation.
Yes. What's the problem?
I feel a lack of energy and my whole body is tired.
Do you have a fever?
No, but sometimes I feel like vomiting.
How about your appetite?
I have had no appetite for a while.
Have you ever felt this way before?
No, I haven't.
And did you notice the color of your urine? Was there anything different?
Yes, it was quite dark.
You seem to have acute hepatitis and jaundice as well. Don't worry, it doesn't seem to be serious.
What should I do then? Do I have to stay in the hospital?
No, I'll give you some medicine to help relieve some of your symptoms. Anyway, if you don't feel better, please come again.
Okay. Thank you very much. Conversation. Good morning, doctor. I've come here for a consultation about my health.
Good morning. So, what's wrong?
I feel very tired and I lack energy to do anything, and I also have no appetite.
Do you have a pain somewhere or a fever?
I don't have a fever, but I have a sharp pain at the upper right side of my stomach. Sometimes my stomach feels distended.
Okay. Do you drink alcohol?
Just occasionally.
Are you taking any medicine?
Yes, I always take some digestive aids after a meal.
You have to refrain from drinking alcohol. You will have to come to the hospital regularly for a while until your conditions are better. Try to avoid strenuous activity.
Will I be able to get well soon?
You have to be patient for a complete recovery. I'm not sure how long it will take. It may be 4 to 6 months.
Okay, I understand. Thank you very much. I feel languid and I have no energy to do work or anything. I also have no appetite because whatever I eat is tasteless. I sometimes feel like vomiting.
How long have you felt this way?
A few weeks.
Do you feel a loss of sexual desire?
Yes. I thought it was because of the tiredness.
Do you drink alcohol a lot?
Yes, especially when I go out with my friends.
Okay. Let's take a CT scan to make sure.
Okay.
I'll tell you when I get the results of the imaging. You have to give up drinking alcohol. You should have nutritious food high in protein and vitamins, such as vegetables and fish. It's important for you to take good care of yourself and relax sometimes.
How long will it take to get well?
I'm not sure. Anyway, you should follow my instructions strictly and be patient
Conversation.
for recovery.
I have a sharp pain at the right side of my abdomen. Today I even began to have a pain in my back and my right shoulder.
When did you start to have this trouble?
Since last week.
Do you have pain anywhere else?
No.
Do you feel nauseous?
No, but my stomach feels distended and swollen.
Have you been eating greasy food a lot?
Yes, I like fried food very much.
You may have gallstones, but let's take an X-ray to make sure.
Okay.
We will talk about this again when I have the results of the X-ray. Please come again tomorrow.
If I really have gallstones, do I have to have surgery?
I can't give you any conclusions until tomorrow.
So, what should I do if I start getting the pain again?
I'll give you a painkiller. You can apply a hot or cold compress when you have severe pain. It should be better. And you should avoid overworking because it can cause pain.
Okay, I'll follow your instructions. By the way, I still worry about the operation.
Take it easy. Today we have very good medicine. Maybe you don't have to have surgery.
Really? I feel better to hear that. Thank you very much. I'll come again tomorrow. Conversation.
What brings you to see me today?
I feel there is something wrong with me, so I came here.
Okay. Please describe your problems.
I don't feel very well. I feel nauseous and I often urinate during the day.
Do you break out in a cold sweat?
Yes, and I have suddenly started to gain weight.
Do you feel dizzy?
Yes, especially when I stand up. My vision has been getting worse as well.
Do you have pain anywhere?
My whole body aches, and my hands and feet are numb. I also often have boils.
Do your hands shake?
Yes.
Have you ever received treatment for diabetes before?
No, I haven't.
You seem to have diabetes.
That sounds very bad. What should I do, doctor?
Don't worry. Just follow my instructions and the treatment given by the hospital. You will improve
Conversation.
soon. Good afternoon. What's the problem?
Good afternoon. I feel uncomfortable when I have a bowel movement.
How?
I pass blood. My stomach feels bloated and rumbles. I have been constipated for 4 days.
Are you often constipated?
Normally not.
Have you ever had abdominal surgery?
Yes, I had an appendectomy 2 years ago.
Okay, let's take an X-ray. Just follow me this way.
Okay.
We will talk about your problem again after we have the results of the X-ray.
It seems very serious.
Don't worry. Please relax. Everything will be
Conversation.
okay. Is there anything wrong with you?
I have a problem with my urine. I urinate much more frequently than normal.
Do you have pain somewhere?
Yes, I have a sharp pain around my bladder and near my kidneys.
What color is your urine?
It's orange, and sometimes it's pink. And it takes longer for the urine to come out when I have to urinate. That makes my abdomen painful.
Do you often get up to urinate in the night?
Yes, about 5 times.
Do you notice any dripping after the urinating?
Yes, there seems to be blood and pus.
You may have an acute inflammation of the urethra or a venereal disease such as syphilis. Let's make an examination.
Conversation. Doctor, please help my son.
Please calm down. What's wrong with him?
There is a lot of prickly heat on his body, head and face. It seems to be very itchy. He scratches and cries all the time.
How old is he?
He's 1 year old.
Is he allergic to anything?
No, I don't think so.
Okay, let me see.
Okay.
It seems to be eczema.
Is it serious?
Don't worry. This problem occurs amongst babies. I'll give you a prescription.
Thank you very much.